Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP. Today we are talking about Levomilnacipran, also known by the brand name Fetzima. Before we get started, remember that this education is for learning purposes only. It does not replace medical advice, diagnosis, or treatment from your healthcare provider. Please do not start, stop, or change any medication without speaking with your prescriber. Alright, let's talk about Fetzima. And don't worry, we are going to keep this simple. We are not here to turn serotonin, norepinephrine, blood pressure, and urinary hesitation into a pharmacology obstacle course. We are here to understand the medication in a way that patients, families, students, and providers can actually use. No unnecessary big words. No confusing medication gymnastics. Just clear education with a little fun. What is Levomilnacipran? Levomilnacipran is an antidepressant. It is also known by the brand name Fetzima. It belongs to a class of medications called SNRIs. SNRI stands for serotonin norepinephrine reuptake inhibitor. That sounds like something you would see on an exam question right before your brain says, I should have studied yesterday, so let's break it down. Serotonin is involved in mood, anxiety, sleep, appetite, emotional regulation, and stress response. Norepinephrine is involved in alertness, focus, energy, motivation, attention, and the body's stress system. Reuptake inhibitor means the medication slows down how quickly these chemical messengers are taken back into the nerve cell after they send their message. In simple terms, Fetzima helps serotonin and norepinephrine stay available longer between brain cells, so the brain can communicate more steadily over time. It is not a stimulant. It is not a benzodiazepine. It is not a mood stabilizer. It is not emotional caffeine. It is an SNRI antidepressant. Think of depression like the brain's motivation and mood system running on low battery. Fetzima helps support the chemical messages involved in mood and energy. It does not do your laundry. It does not answer your emails. It does not magically make your problems disappear. But it may help your brain have more emotional and motivational bandwidth to function. What is Fetzima used for? Fetzima is used for major depressive disorder in adults. Major depressive disorder may include symptoms such as depressed mood, loss of interest, low motivation and low energy, poor concentration, sleep changes and appetite changes, feelings of guilt or worthlessness, emotional heaviness and slowed thinking, difficulty functioning at work, school or home. A patient may say, I feel stuck. I have no energy. I cannot get motivated. I am dragging myself through the day. I want to care, but my brain feels disconnected. I feel emotionally heavy. Fetzima may be considered when a provider is treating adult depression and wants an antidepressant that affects both serotonin and norepinephrine. A simple teaching line is, Fetzima is an SNRI antidepressant used for major depressive disorder in adults. It may help mood, energy, motivation, and function over time. Let's go a little deeper, but still keep it simple. Your brain cells are called neurons. Neurons communicate using chemical messengers called neurotransmitters. Two of those messengers are serotonin and norepinephrine. Here is what normally happens. A brain cell releases serotonin or norepinephrine. The chemical messenger travels across a tiny space between brain cells called the synapse. The message is delivered to the next brain cell. Then the first brain cell pulls the messenger back in. That pullback process is called reuptake. Fetzima blocks or slows this process. That means more serotonin and norepinephrine stay available in the synapse. Fetzima helps mood and energy-related messages stay available longer, so the brain has a better chance to use them. Now, Fetzima is a little different from some SNRIs because it has a strong norepinephrine effect. That means it may be more activating for some patients. This can be helpful when depression looks like low energy, low motivation, low drive, low focus, feeling slowed down, or feeling emotionally stuck. But the same norepinephrine effect can also cause side effects such as increased heart rate, increased blood pressure, sweating, jitteriness, insomnia, and anxiety activation. Think of norepinephrine like the brain's get up and respond messenger. Too little, and the brain may feel sluggish. Too much, and the body may feel like it drank coffee it did not order. Fetzima helps increase that signal, but the dose needs to be appropriate for the patient. Fetzima is not a rescue medication. Fetzima is not a medication patients take only when they feel depressed. It is not a panic button. It is not like taking Tylenol for a headache. It is not a medication to take only on bad mood days. Fetzima works best when taken consistently every day as prescribed. A simple teaching line is, take Fetzima daily, not just on hard days. It works by helping the brain build steady changes over time. If a patient takes one capsule and says, I still feel depressed, that does not mean it failed. At one dose, Fetzima has barely learned where the brain keeps the coffee mugs. How long does Fetzima take to work? Fetzima does not usually work overnight. A common timeline may look like this. Week 1 to 2, the body is adjusting. Side effects may show up before benefits. Week 2 to 4, some early improvement may begin. Energy, motivation, or mood may start shifting. Week 4 to 8, depression symptoms may improve more clearly. Beyond 8 weeks, dose adjustments may still be needed depending on response and tolerability. Do not declare the medication a failure too early unless there is a safety concern. At 1 week, Fetzima is still unpacking its suitcase. Give it time, but monitor closely. Starting dose, titration, and maximum daily dose. Fetzima is an extended release capsule. A common starting dose is 20 mg once daily for 2 days. Then the dose is commonly increased to 40 mg once daily. Based on response, the dose may be increased by 40 mg at intervals of at least 2 days. The usual dose range is 40 mg to 120 mg once daily. The maximum daily dose is commonly 120 mg per day. The goal is not to race to the maximum dose. We are not trying to win a norepinephrine marathon. The goal is symptom improvement with the fewest side effects. More medication is not always better. Sometimes more just means more sweating, more insomnia, more heart racing, and more regret. How patients usually take Fetzima. Fetzima is usually taken once daily. It can be taken with or without food. The capsule should be swallowed whole. Do not open, crush, or chew the capsule. This is an extended release medication. That means it is designed to release slowly over time. The capsule is not medication granola. Do not sprinkle it, do not chew it, do not perform capsule surgery at the kitchen table. A simple teaching line is, take Fetzima once daily at the same time each day. Swallow it whole, and do not crush, chew, or open the capsule. Common side effects may include nausea, constipation, sweating, increased heart rate, and increased blood pressure, palpitations, insomnia, and dizziness, dry mouth, vomiting, decreased appetite, anxiety, jitteriness, and headache, sexual side effects, and urinary hesitation. Fetzima can be more norepinephrine forward, so body activation symptoms matter. If a patient says, my heart feels like it is trying to leave the building, we need to check pulse and blood pressure. This is one of the most important teaching points. Fetzima can increase blood pressure and heart rate. Before starting and during treatment, providers should monitor BP and pulse. Patients should report chest pain, fainting, severe dizziness, shortness of breath, fast or irregular heartbeat, or marked increase in anxiety. If the heart says, excuse me, I need attention, we listen. Fetzima can cause urinary hesitation or difficulty urinating in some patients. This is more likely because of norepinephrine effects. Patients should report difficulty starting urination, weak urine stream, painful urination, or feeling unable to empty the bladder. This is especially important with prostate problems. Do not let the patient suffer silently. A simple teaching line is, if urination becomes difficult after starting Fetzima, tell your provider right away. Bladder symptoms are a side effect conversation. Important safety warnings. Antidepressants, including Fetzima, may increase suicidal thoughts and behaviors in children, adolescents, and young adults. Monitoring mood is important at every age. Watch for worsening depression, new suicidal thoughts, agitation, or impulsivity. If in immediate danger, go to the emergency room or call 988 for the Suicide and Crisis Lifeline. Before starting Fetzima, screen for bipolar disorder. Ask about past episodes of decreased need for sleep, racing thoughts, grandiosity, or impulsive behavior. If someone says, "I slept 2 hours, started 3 businesses, and decided I should become governor," we are not just calling that productivity. We are screening for mania. Serotonin syndrome can happen when serotonin activity becomes too high, especially when combined with other serotonergic medications. Symptoms: agitation, confusion, fever, muscle stiffness, and fast heart rate. Examples that increase risk include MAOIs, tramadol, St. John's wort, or other serotonergic antidepressants. Do not let the medication list have secrets. Secrets are for surprise birthday parties. Stopping Fetzima suddenly can cause discontinuation symptoms: dizziness, nausea, headache, irritability, or electric shock sensations. Do not stop suddenly without guidance. Fetzima does not appreciate being ghosted. SNR can increase bleeding risk, especially with NSAIDs or anticoagulants. Also, watch for angle closure glaucoma. Seek urgent care for eye pain or vision changes. Eyes deserve attention too. Dose adjustments may be needed for kidney impairment. Fetzima is also metabolized through CYP3A4. Strong inhibitors can increase side effects. The kidneys are not background characters. Tell your provider about all prescriptions, OTC meds, and supplements, because sometimes still counts. The medication list is not paperwork, it is the map. Families can help monitor mood changes, suicidal thoughts, and side effects. Medication and therapy are teammates. One is not the superhero while the other holds the cape. Let's review the teaching points. Number 1. Fetzima is Levomilnacipran, an SNRI for adult MDD. Number 2. It affects serotonin and norepinephrine. Number 3. It helps over time, not as a rescue. Number 4. Start at 20 milligrams, then 40 milligrams, up to 120 milligrams per day. Number 5. Swallow the capsule whole. Number 6. Monitor blood pressure and heart rate. Number 7. Watch for urinary hesitation. Number 8. Screen for bipolar disorder. Number 9. Watch for serotonin syndrome and discontinuation symptoms. Number 10. Keep education simple and thorough. Levomilnacipran is a tool. When explained clearly and combined with therapy and healthy habits, it can be very helpful for adults with depression. Thank you for watching. Again, my name is Dr. Ben Osevwe, DNP-PMHNP. For support, you can text 83299165116. Please subscribe to our YouTube channel and join our mentorship family today at rotationmatchnetwork.com. We'll see you in the next video.